Welcome to your regenerative medicine appointment. Your care manager will be with you momentarily. Before we get started, let's learn a little more about regenerative medicine.
The cells will travel through the bone directly to the cartilage surface to potentially regenerate the cartilage and treat the disease.
I've had PRP in my knees. I actually had knee surgery on my left knee.
Active baby boomer Eileen Feldman was in to have stem cells injected in both knees. She loves to hike, box, and cycle, and is looking for a new way to reduce the pain.
I've already had bone marrow in my hips. It was amazing.
White spots on an MRI indicate areas where there are bone fractures and decay. Injecting bone cells beneath the cartilage.
Within 3 to 6 months, we see the bone regrow and improve to its normal state.
The price of these procedures vary anywhere from $500 up to about $11,000, and they're not covered by insurance. But when you consider a knee or hip replacement could cost upwards to $50,000, and the downtime, this is certainly something to take a look at.
We do have clinical trials ongoing, and we also created a non-for-profit and a registry.
We believe the most educated and knowledgeable patients will make the best decisions about their health care. It's important to understand the 7 principles of integrative medicine. Patient-practitioner partnership. This is a partnership between you and our office. You are not in this alone. We do investigate the underlying cause rather than just treating symptoms. We combine traditional and alternative treatments to ensure that you have the best outcome. We consider all factors of wellness, and we critically evaluate outcomes through re-examinations. This is good medicine based on good science. Everything that we do is supported by scientific data. And we focus on natural, less invasive interventions so that you will use less drugs and surgery as you go along. There are 2 types of pain in this world: pain that hurts you and pain that changes you. Whether it be nerve, back, joint, neck, shoulder, foot, or hip pain, we can help. Pain that hurts you is simply maybe a cut or a broken bone. But pain that changes you is one that stops you from doing the things that you need and love to do in life. This can affect you emotionally and can cause some dependency on chemicals, whether that's pain relievers, sometimes it's sugar, sometimes it's alcohol, but we are glad you're here. There are 2 progressive degenerative diseases, osteoarthritis and peripheral neuropathy. There is no cure for these, and if left untreated, both conditions will erode the quality of your life and threaten your independence. So when you found out that you had joint degeneration, what were your choices? Usually surgery, could be exploratory, could be joint replacement. This image here is showing a total knee replacement. This is very invasive, and the recovery time can be up to a year. Medicine, steroid injections, oral steroids, opioids, NSAIDs, ringing in the ears, headaches, rash, difficulty breathing, weight gain, high blood pressure, restlessness of the limbs, constipation can all be side effects of these medications. According to the MayoClinic.org, potential side effects of cortisone shots can cause cartilage damage, death of nearby bone, joint infection, nerve damage, flare of pain and inflammation in a joint, increase in blood sugar, which is important to note if you're diabetic, tendon weakening or rupture, thinning of nearby bone, osteoporosis. So the more cortisone shots that you have, the potential for these increase and push you in the direction of having surgery. Opioids is another commonly prescribed medication to deal with joint pain. The stats are staggering. If we just look here in 2021, 107,000 deaths from drug overdose. That means pushed or prescribed street drugs and prescribed medications. 71,000 of those deaths were from opioids. What is the importance of regenerative medicine? It's an alternative to drugs and surgery. Regenerative medicine harnesses the body's innate intelligence to restore, remodel, and regrow tissue, bone, ligament, tendon, and cells. We focus on nutrition, motion, alignment, and support for your joints. I do want to talk about the different types of modalities that we can use to help with joint degeneration. Hyaluronic acid is one commonly prescribed by primary care physicians. It is a lubrication for the joint, and it's non-toxic. We did talk about steroid injections. They are synthetic and anti-inflammatory. They don't do anything else to heal or repair the body. These three are the best. However, these two are invasive and pull stem cell from your own body. It's important to note that your stem cells are as old as you are. So these two would require a procedure in order to extract those. Our desired method is umbilical cord tissue. This is birth tissue from donated cesarean sections of mothers that have been pre-screened. This would be the umbilical cord, not anything from the baby. So I just want to be very clear on that. So just like these two here are the most powerful, umbilical cord tissue is even more powerful because of the cell count that is in those. We'll cover this in the next slide. Platelet-rich plasma is blood that we pull from you, spin down, and we take the plasma and we're able to inject that back into an injured site, which stimulates the healing process, but it also is very nourishing for stem cells that we put into the body. Amniotic fluid is also a great alternative. Again, from donated birth tissue from the amniotic fluid. It does have the absence of stem cells, although it is a great product as well. There is an impact on aging of the ratios to stem cells to bone marrow cells. You can see here a newborn has 1 stem cell per 10,000 bone marrow cells. You can see that quickly decreases over time. By the time you're 50, you have 1 stem cell per 400 bone marrow cells. And your cells are as old as you are. There are many factors to consider. Are you healthy? Are you inflamed? Do you have any other disease processes? So stem cells are undifferentiated cells that have the capacity to both differentiate and multiply into the 200 cell types that form us as a human being, whether that be muscle, cells, tissues, ligaments, tendons. When we put this into the body, it starts to repair based on where your body says it needs the extra help. We do plasma, platelet-rich plasma, where we take your blood, spin it down, and then we pull the plasma and we're able to inject that back into the joint site. We are not a one and done clinic. We focus on regenerative and PRP injections, specialized nutrition, other support including chiropractic care, manual therapy, stimulation, light therapy, physical medicine, and re-exams. There is online support. Today you're with us on Body Site. Momentarily you will be on with your care manager. Please be as honest as possible so we are able to help you in the best way possible. When you are finished with this video, please write done in the comment section on My Body Site, and your care manager will be right with you.